With this model, we're going to talk about a couple of different ways that we can feel a closing side problem. So we talked previously about the opening and closing sides of a joint, such that if we move in this direction, and these bones are moving in the joint capsule, we get an opening side stretch and a closing side muscular contraction. And if we were going to move the joint this way, we could call this, for example, the big toe moving down into flexion. What we'd like to see is a stretch on the opening side up here. This tissue is getting longer, and a feeling of muscular effort down here on the closing side. Sometimes people will feel discomfort on the closing side of a joint. And there's a couple ways we can think about that happening. There can be more than this, but these are sort of the usual suspects at first. So the first one is what we call shortened tissue that doesn't know how to contract. So this is tissue that can't maintain stiffness as it's trying to contract, because we don't have the muscular skill to actually make that tissue get shorter. So in this case, as the joint's articulating on the closing side, instead of this tissue remaining tense and actually pulling into the joint, it loses its ability to create stiffness, and this tissue sort of sags into the joint here. So your body's going to sense that this is happening, that we're not able to maintain this stiffness on the closing side. We can't pull this tissue at this particular length, so the tissue just stays the same length and it gets stuck in the joint here. That's going to be commonly felt as a pinching sensation. It's usually pretty bright, and it's the kind of thing we'd really want to avoid all the time. Now, another way we can get a closing side problem, this would be classified as a closing side problem or pain, closing angle joint pain. Another way we can get that is, instead of having a nice, wide, healthy, symmetrical joint capsule in this particular case, let's imagine that we have a much smaller joint capsule. For whatever reason, there's just not that much space in between the bones. And so we're dealing with a very limited amount of space, which will be represented by the red here. So now we don't have much joint capsule space in between these two bones. So in this example, if we had some articulation happening here, it's not going to go very far because there's just not enough room, there's not enough space in the joint capsule. So now as this closing side muscle makes this effort and pulls in, now instead of the superficial tissue being sort of dipping towards the joint and being a scared situation for your body causing pain, this now is going to be the two bones positions are too close to each other. What we want in a case like this is more capsular space to actually create that clearance on the closing side in the joint between the bones. So that's the two different types of closing side pains that we can have. The first one is when the tissue dips towards the joint or into the joint. And the second one is when we have a shape of the joint or not enough room overall that forces those two bones into too much proximity deeper in the joint itself. The second one's going to typically feel more like a blockage, like a hard stop, a hard block. Whereas if we have this tissue that dips towards the joint, that's often going to feel like a pinchy sensation, a really bright sensation. It's also possible to have both of these statuses at the same time. So it's not always a hard rule that it's going to be one way or the other. And sometimes it can take some time to sort out which one needs to be cleared first and how we go about doing that.